All right. Good morning, everyone. Thank you so much for joining us on this beautiful Friday morning. It is 10:31 on my count, so let's go ahead and get started. My name is Kelsey Berkfeld. I am the Director of Advocates for Ohio's Future. And we are joining you today as a coalition of health and human service policy, research, and provider organizations really united to make sure that our state governments and other elected officials are paying attention to the most vulnerable populations throughout our states. We want to ensure that really families who are struggling with basic needs have the supports in place, and they're easily accessible to make sure that those families can continue and live as successfully and as healthily as possible. So today we are very excited to introduce not only our budget priorities moving in to the state budget. We are currently on the eve of budget season beginning tomorrow, or excuse me, on Monday, not tomorrow. We have the weekend to rest up to talk about really what we're going to expect to see in the governor's budget, as well as some of those federal executive orders and different actions that we're seeing come down at a record-breaking pace, I would say. Lots of information in the past few weeks coming down from the federal level. So we have a jam-packed agenda today. Again, thank you so much for joining. A couple housekeeping items. Wanted to tell you we will be taking questions at the end of our presentation today, and please submit those through the chat. We'll get to as many as we can. And the slides, as well as the recording, will be posted on Advocates for Ohio's Future's website later this afternoon, and that's at advocatesforohio.org/webinars. I am joined today by my executive leadership team. I'm very privileged and honored to work with these folks every single day. They are listed here in order of appearance in today's schedule, so I'm very, very happy for them to join us and grateful for their time this morning. So let's kick things off with a very brief kind of frame for our state budget moving in to the next few months. So once again, Governor DeWine's executive budget proposal is due on February 1st, this coming Monday. We've heard some rumors that they're still working on it. We know that projections, especially budget projections, have been really difficult, and the environment's constantly changing as far as what those state revenues are going to look like given the economic crisis and recovery from the coronavirus pandemic. So we will be anxiously awaiting those release of those documents on Monday and digging in to do our initial analysis. Some good news, state revenues are not as dire as once predicted. We know a couple months ago, we saw some big cuts. As of now, OBM is reporting that some of those major tax indicators of revenue indicators are doing as well or even better than they predicted before the pandemic. And then even on a national scale, Ohio is doing a little bit better in terms of a back to normal measurement for our economic recovery. So good news on that front, but we are not out of the woods yet. There are a couple things that we need to keep in mind when we think about our state budgeting process for this year. We know that our unemployment insurance, a lot of Ohioans needed extra support and filed claims over the past year. As of about June of last year, Ohio has been borrowing that money from the federal government. This is, along with many other states, Ohio is not the only one. So we will have a hefty sum to the tune of hundreds of millions of dollars to repay to the federal government once this pandemic and this crisis has subsided. I do know at the beginning of the pandemic, earlier last year, had just paid off our loan from the federal government back from the Great Recession back in the mid 2000s. So it does take a while, but I know Ohio will have to think about an effective strategy to pay those dollars back. We are also experiencing increased enrollment in Medicaid. So this is the state's healthcare coverage. Though my friend Steve will tell you a little bit later that the federal government is contributing a larger share to those Medicaid expenses. Increased enrollment does mean an increased obligation from the state to make sure that those Ohioans who qualify have that healthcare that is so vital and necessary, especially during a pandemic. Also, we've seen some large sums of money come into Ohio from our coronavirus relief bills. I will say these dollars, especially those CARES Act dollars that we've heard so much about, have been incredibly helpful. However, they have really kind of restrictive strings and just parallels and frames as to how they can be used. So they can't just be used to plug budget holes as they come up. They have to be used for a specific purpose. And that reporting is really, really important back to the federal government. There's also usually timelines associated with those dollars on how they can be spent. And looking into the next budget, Governor DeWine has signaled that he will not hesitate to use the Budget Stabilization Fund, or the Rainy Day Fund, as we affectionately call it. Right now, it's to the tune of about $2.7 billion in that fund. The governor has not tapped into it yet. So we will, again, anxiously wait to see what his plans are for those dollars. Hopefully come Monday, we'll know more. We do know that Governor DeWine has also made some requests to President Biden to help with the coronavirus pandemic response in Ohio. Obviously, there's 7 items here on this list. Very, very important to, again, continue our state's recovery and make sure that our citizens have what they need to ride out the pandemic as safe as possible. 2 items I wanted to highlight. Governor DeWine did ask for $350 billion from the federal government to assist state and local governments. We know that they have had some big hits in terms of making sure that they can provide services, things that were not previously budgeted for, and again, wanting to make those dollars as flexible as possible to be used as effectively as possible. And also, again, Steve will tell us a little bit more about what's happening with the federal share of Medicaid, but also wanted to make sure there's some predictability from that higher level that we're getting from the federal government. So we know when that may come down, we can predict kind of what's going to happen with those funds and that assistance moving forward. So when our coalition sat down to think about what we should focus on and really focus our efforts for the state budget season and our advocacy really throughout the whole next year, we wanted to focus on, again, those Ohioans who are the most vulnerable, who are more directly impacted and negatively impacted by the coronavirus pandemic. We really wanted to target those families who are low or no income, Black and Brown communities, who were either struggling already before the coronavirus hit or right on the brink. We wanted to make sure that state resources and policies really target and support those communities and those populations throughout the budget. We want to see increases in basic needs assistance and investments in work supports so that those folks who did lose their job or are struggling due to the pandemic have what they need to survive and be healthy and support their families as they look for new opportunities. We also are encouraging our state legislators to have a balanced approach to the state budget and make sure we examine current tax expenditures and also new revenue opportunities to really solve Ohio's most pressing needs, and again, ensure that our vulnerable populations are supported. And also, of course, equity should be an explicit consideration when constructing this state budget. We know that, again, those resources, really valuable resources and services, should target our at-risk populations. And with that being said, I will turn the stage over to Steve Wagner. He is co-chair of AOF and also the executive director of UHCAN Ohio. Steve, take it away.
Thanks. Good morning, everyone. So I think the first thing that's from a federal action standpoint that will have an impact on state budget is the extension of the public health emergency. So the Biden administration said that, provided in a letter to governors, saying that they would be extending the public health emergency through 2021. Recall they can't actually do that except in increments. There are 90-day extensions that can be issued, but the administration is committed to continuing to extend that public health emergency through all of 2021, and then to give the states at least 60 days notice that they would not be extending that. That public health emergency allows for lots of accommodations in terms of how Medicaid's provided, telemedicine, some other accommodations that happen, but also critically, it extends the enhanced federal match for Medicaid. In Ohio, that's probably about 300 million a quarter additional dollars that come to Ohio um, to help to pay for the Medicaid expenses. So that's pretty significant. The other aspect of the enhanced FMAP is that there's a maintenance of effort requirement in there. And so while that FMAP is in place, individuals cannot be disenrolled um, except if they die. So there's not a redetermination process that is happening in Medicaid right now. So that guarantees that people are going to continue to have that critical health care coverage that they need. And it's also important that Governor DeWine asked for that kind of off-ramp for the FMAP. So back in the Great Recession back in 2009, there were this step down of that enhanced match rate. And Governor DeWine has asked the Biden administration to consider that, how they do that. It would require legislative action to do that kind of thing. So we'll see how that plays out. The super critical thing that has happened is that there will be a reopening of the ACA marketplace. There are well over 100,000 people that are uninsured in Ohio. The ACA marketplace opening will allow people to get that coverage. And what people might not realize is that there are plans out there, bronze plans, that people can get in some areas that are actually would be no cost to them because of their income level. So it's Kaiser Family Foundation estimates that there's probably about 60,000 people in Ohio that could get a bronze plan without having to pay a premium after they got their subsidies. So when the marketplace opens again in February 15th, for those that are uninsured, it's critical that they take a look, see what their options are in terms of getting plans. And there should be more assistance out there during that time period for people to get help and find out if they can get a plan. And then finally, in terms of federal action, CMS will revisit the Medicaid and ACA kind of demonstration waivers that are out there. In Ohio, that particularly applies to the work requirements waiver. You might remember that CMS issued some guidance about how broadly they would consider work requirements. That's important in that the agencies are directed to review these policies that could limit access to healthcare, including the Medicaid program, and that the policies shouldn't undermine the protections for people with that should be able to get that healthcare coverage, or in the case of the ACA, the ways in which the ACA has been undermined in protecting people with pre-existing conditions. So while I was hoping that maybe there would be a wholesale throwing out the work requirements guidance that CMS issued, I think that's coming, and that this is the signal for that. Into state actions, we have had many people who have needed to rely on Medicaid for that support during this really struggling time. So we've seen 300,000 new Medicaid enrollees over the past year. Fortunately, it appears that, across the board, people are not getting as much health care as they normally would during this pandemic period for lots of reasons. So there might be a decrease in how much the actual expenditures per person are, but we have increased the enrollment. And part of that is just that people aren't falling off the rolls because of that stoppage in terms of redetermination. And then super good news for Ohio is the managed care reprocurement. So 90% of the people on Medicaid are in managed care plans. Medicaid's moved forward with a very person-centered approach to how care and that insurance should be provided. And we're really hopeful to see how the awarding of contracts to managed care plays out over the next week or so, and how that Medicaid moves forward with that. Thank you very much. And so, I should say that this is really one of the hallmarks of where we're at. We believe that maintaining Medicaid eligibility without barriers or cuts, so not cutting that eligibility, not cutting the benefits that people have, is pretty critical, both for families in the recovery, but also for the economic recovery out there, because healthy people are able to work, and maintaining their healthcare coverage is critical for them to be able to return to work as this pandemic crisis and the economic crisis with it starts to move away.
Steve, thank you so much. Next up, we have Susan Jagers, is the Executive Director of the Ohio Poverty Law Center. We also have Dr. Tracy Najerá, the Executive Director of the Children's Defense Fund Ohio. Take it away when you're ready.
Good morning. I will start by talking a little bit about access to broadband and some happenings at the federal level. So as we are connecting with you, and for many Ohioans, the pandemic has turned the internet into a critical lifeline. It's how we connect to our jobs, our doctors, our families and friends. Children need access for schools, but unfortunately in Ohio, there's more than 1 million Ohioans who lack internet access, and they're even more disadvantaged amid the pandemic. Many of these households are in rural areas where infrastructure for high-speed internet just doesn't exist. But the majority live in cities and suburbs and small towns where broadband may be available. But for many of these unconnected Ohioans, the main barrier is not geography, but cost. For example, 27% of households in the city of Cleveland had no internet access of any kind. And Cleveland is not alone and not the only city with large portions of their residents unconnected or underconnected. In 2018, 2/3 of Ohio households without broadband and household incomes without broadband access had household incomes below $35,000, and nearly half had incomes below $20,000. The monthly bill for a home internet connection in most Ohio communities is now at least $60 or $70 a month, and that's just not affordable for many Ohioans who are already struggling to get by. So there's some good news with some additional federal resources to help connect Ohioans in a better way. Just in terms of changes with the FCC, there's a new acting chair as of this week, and with Biden appointments, we may see a greater focus on consumers and affordability going forward. And we know that there may be a proposal for more money for infrastructure from this administration. But even before the Biden administration, the last relief package that was approved in late December, the Consolidated Appropriations Act, did invest additional resources to expand access. And this is really good news. The package includes a total of $7 billion to expand access to broadband, and includes a couple of new programs. One is a $285 million grant program. It's a new Connecting Minority Communities pilot program to provide grants to historically Black colleges and universities, tribal colleges or universities, and minority serving institutions for the purchase of service and equipment, and to hire and train information technology and personnel. The federal relief package also included $250 million in additional funding for the FCC's COVID-19 telehealth program, which supports broadband for health-based teleconferencing. So there's more money being invested into the telehealth program. But one of the most exciting pieces of the relief bill was a creation of a new $3.2 billion emergency broadband benefit program for unemployed or qualifying low-income households. And this program would provide, or will provide, $50 monthly discount off the retail price of broadband internet access services to an eligible household. So there are a couple ways that a household will be eligible for this new program and benefit. The legislation says that if at least one household member is eligible for the federal Lifeline program that helps make sure people are connected with phone services, they would be eligible for the program. And the eligibility for that program is a household that is at or below 135% of the federal poverty level, or participates in SNAP, Medicaid, housing assistance, SSI, veterans and survivors pension benefit. So that's the eligibility for the program under that category. Also, if a person or if a household has at least one member who qualifies for the free and reduced price lunch program, the household would be eligible. If a member of the household has experienced a substantial loss of income since February 29th, 2020, that is documented by layoff or furlough notice or an application for unemployment compensation, they could be eligible for the program. If a member of a household has received a federal Pell Grant in the current award year, they would be eligible for the program. And if a household member would meet the eligibility criteria for an existing provider's low income pandemic program, they would be eligible for this program as well. Since this is a new program, the FCC is working on developing the implementation, and they're required to issue implementing regulations 60 days after the bill's enactment date. So we should see the program up and running and available by the beginning of March. They did have a public comment period that ended this past Monday, and we know that more details about the program will be coming in the next couple of weeks. But what we do know is that the program will be available through the internet service providers, and consumers can check with their provider for more details as we get closer to the implementation date of this program. So while this is a temporary program during the pandemic, it does set up a program that could become a framework for a longer term plan to make access more affordable for low-income Ohioans. And I think that's the exciting part of this program. There hasn't been that kind of broad-based program to help with affordability for access to broadband services for low-income Ohioans. And with that, I will turn it over to Tracy for some state updates.
Thank you, Susan. So as Susan said, we are at serious risk in the state of Ohio of creating two very different Ohios. One where people have access to internet and they are able to afford service, and one where that just doesn't exist. Now, at the state level, there has been studies in the past year and a half, most notably by the Buckeye Hills Regional Council, that try to estimate what does that gap look like in terms of dollars and cents for this essential infrastructure. And they pegged it at around $2 billion. And also that it would take at least 10 years to build out this infrastructure, because we all acknowledge this cannot happen overnight. It'll take time, and it'll take very deliberate effort over that time and investments. So when we talk about work that's going on at the state level, you know, it's encouraging. However, there is also a sense of urgency that more needs to be done faster. In this last General Assembly, there was a House Bill 13 sponsored by Representative Carfagna that, you know, had a lot of support. There was a lot of excitement, probably tempered excitement about it. You know, it was a step in the right direction. However, that legislation did not pass. It actually just expired. And in this new General Assembly, Senator McCauley has introduced Senate Bill 8, which is essentially the same legislation. It would create a small grant, or a small fund called the Ohio Residential Broadband Expansion Grant. It would have about $20 million in it. So when you think about $20 million and you think about $2 billion in need, it's a small amount of money, But again, it's, it's a positive step in the right direction. Now, a couple things that at the state level are needed are number one, many of our regional councils and our local governments, they have access to many different types of federal grants to build out this essential infrastructure for broadband. However, what a lot of them lack is capital. They lack the local match to actually draw down some of those federal dollars. Now, some of these regional councils have estimated that about $30 million per year would be needed to draw down about $200 million per year in federal dollars. So the money is out there at the federal government. We just need to be able to make sure that our local governments have the cash on hand where they can access it. So that is a critical need. As Susan mentioned earlier, affordability is also a need. For many families who are struggling to put food on the table, having a $60, $70, $80 internet bill is just not feasible. Now, many providers, especially during the pandemic, have discounted their rates, especially for families with children in grade school and enrolled in higher education. However, this must continue, and also not just for for families with school-aged children, but for families that have, health issues or need to access, other types of workforce training, or, the list can really go on, because internet access is really your lifeline to economic stability, to health, to education, and so many other things. Now, a couple other items that we would also like to see is grants for devices and also for internet culture or competencies. So just because an individual like a senior citizen or maybe a young child has access to a device and the internet, being able to navigate the use of that device and the use of, how to access different tools is also important. So there's a multitude of needs here. And the state, through Broadband Ohio and the leadership through DSA, they have taken the right steps in the right direction. However, we're also here to say that more is needed so that local governments can access the federal opportunities that exist. I will pass it back to Kelsey.
Thanks so much, Tracy, and thank you so much for your presentation. And that, again, leads us to our second budget and policy priority for AOF as a coalition. We really want Ohio's legislature to focus on both access and affordability when approaching and the problem of broadband access and really connection throughout the entire state. With that being said, I will pass things over to Tara Britton, our co-chair of AOF and Policy and Advocacy Director at the Center for Community Solutions, followed by Lisa Hamler-Fugitt, the Executive Director of the Ohio Association of Foodbanks. Take it away, Tara.
Thanks so much, Kelsey. Thank you all for joining us today. I'm going to talk a little bit about the federal actions that we've seen related to TANF and other basic assistance before we turn it over to our food and nutrition expert, Lisa. So what we've seen at the federal level as it relates to the Temporary Assistance for Needy Families, or TANF, entering our acronym world. In Ohio, the cash assistance portion of the TANF program is called Ohio Works First. And what we've seen in this space at the federal level is that President Biden has included in his proposed emergency relief plan $1 billion in new TANF funds that could do many things. One of which is to increase the monthly amounts that go to families who are eligible and enrolled in Ohio Works First. It could also help with increased expenses. So we have seen throughout the course of the pandemic that the state of Ohio has done what they can. You all may have seen notices from the different job and family service offices around the state that sort of one-time dollars are available to eligible families through the Prevention, Retention, and Contingency Program, or PRC, yet another acronym in this space. And those dollars, were based upon families getting notice that they were available and applying, and they went really quickly. So we know that there is a lot of need out there for those more flexible dollars that can help to, pay rent, expenses in the family, things that families may need to help their children do at home virtual learning. So many things that, we know that those have really truly been used as emergency dollars for families during this pandemic. And we hope that if this is a piece of the COVID relief plan that moves forward at the federal level, that we will have more ability to do things like that. These dollars can also help to improve access to TANF during these difficult times. So we've seen, different, Ohio included, but states around the country that have made accommodations to make sure that people can remain eligible for TANF, and helping them to kind of accommodate what used to be in-person visits to job and family service offices, and finding different ways to communicate with families. I think the main thing I want to add here too is that we don't want to see any dollars that are coming in through an emergency relief package be seen as something that should kind of replace existing dollars or make any moves toward threatening the current structure of the program. Advocates for Ohio's Future, as a coalition, when we talk about our budget priority in a little bit, we really have put together a comprehensive plan to strengthen the state's TANF program, and we've worked closely with the state in doing so thus far. So, these emergency relief dollars are truly that, emergency relief. We want to make sure they're used to mitigate the many harms that this pandemic has caused for struggling families. And, in a time like this, it's really, these dollars are helping the state to avoid cuts and other punitive policies. We saw harsher sanctions and stricter time limits come after the Great Recession. And so we hope that these federal relief dollars can help to avoid that. And I will turn it over to Lisa now to talk about some of the federal actions that the Biden administration has taken as it relates to SNAP.
Great. Thank you so much, Tara. And I want to thank Kelsey and our presenters, but more importantly, I want to thank each and every one of you for the great work that you do in communities across the state as we work with Ohio's most vulnerable in helping them to secure the most basic of all human need to weather this ongoing pandemic. Do want to briefly go over a number of provisions that were made available through President Biden's immediate call to action to address hunger and food insecurity, and efforts that he took to strengthen the first line of defense against hunger in our nation, which is the SNAP program and also the PEBT. As I said, upon taking office, President Biden signed executive orders that would immediately deploy additional emergency resources that are available and were made available through the Families First Coronavirus Response Act in early March. And that was to extend the pandemic EBT benefit increases that help low-income families replace school meal programs when their children are not in school as a result of the pandemic. This executive order will allow for a 15% increase and also extend these benefits to children who are out of childcare settings as well. This is a phenomenal program that's already provided hundreds of millions of dollars of additional federal food assistance benefits to over 800,000 children in the state. It's been made possible because of the hard work of the Ohio Department of Education and the Ohio Department of Job and Family Services. And to learn more about this program, I'm going to pitch tuning in to the AOF webinar that's going to be on February 5th, so you can learn all about PEBT. We also have a wonderful website that I encourage you to link to your website, which is ohioebt.org. All of the latest announcements are available on that website. And again, let us make sure that we're lifting this important benefit up to families who may have a SNAP card, and then for families who are going to benefit from this program who are not involved in SNAP. One of the other provisions of the executive order related to working directly with the Department of Justice to review its authority to allow states to provide the maximum SNAP emergency allotments to the lowest income households. And this was a provision where the Trump administration had blocked congressional action to allow an increase in SNAP benefits for households with the lowest income. And that makes up about 37% of all SNAP households. This is a really important benefit as the COVID crisis has been extended. We're seeing, and we're all experiencing, rapidly rising food costs. This emergency allotment of SNAP benefits will mean about $27 per person per month, or about an additional $100 of SNAP benefits for eligible families of 4 for the next 6 months. And it's a really important benefit. One of the things that we learned coming out of the Great Recession is that there were 2 things that government could do that would have an immediate impact, not only on those who were suffering, but also on the economy. And one was an increase of SNAP benefits. And for every $1 billion in SNAP benefits that were redeemed in local communities to gain access to healthy, wholesome food, that generated over $1.54 billion in gross domestic product, helping the economy. And that's really important. Today in the state of Ohio, 1,467,000 Ohioans who are poor enough to qualify for SNAP are participating, and we estimate that hundreds of thousands more are eligible but not participating. The other directive, which is really important for those of you that know anything about SNAP, benefits are woefully inadequate and generally only last low-income families about 2 to 2.5 weeks out of every month. This executive order directs USDA to evaluate the Thrifty Food Plan, which is the basis of how SNAP benefits are calculated. And it's woefully out of date, and this will provide USDA with the ability to reevaluate what it costs to provide a healthy, adequate diet for households, including the actual cost of living in many areas. This provision was directed in the 2018 Farm Bill, but yet USDA did nothing. This is a high priority right now for USDA, and we are confident that with the new leadership that under Secretary Vilsack, and also our dear friend and colleague, Stacy Dean, who now serves as the Undersecretary of the Food and Nutrition Service for the United States Department of Agriculture, that we'll start to see some major expansion and efforts to utilize SNAP and other child nutrition programs that are available in their jurisdiction. So at this point, I'll turn it back over to Kelsey.
Thanks so much, Lisa. And wanted to highlight this is our third major budget and policy priority moving into the next year. We really want to support the immediate and emergency needs of low-income children and families, and ensure that those TANF dollars are being directed to emergency assistance to work supports to immediate programs that will really, really impact the well-being of those families. And I will actually turn it over very quickly back to Tara to tell us about a couple specific policy recommendations that we've come up with over the past few months.
Thanks so much, Kelsey. So this is a place, again, where we kind of AOF, many of our members have come together to rally around and really, support one another in this work that we're doing to improve upon the TANF program in Ohio, ensure that it's meeting basic needs for families who are eligible. We know that not all eligible families with children are enrolled in utilizing this program. So a couple of, very briefly, our summary, but we certainly have more information as it relates to our TANF work, and Kelsey would be happy to provide that to anyone who's interested. But what we have proposed in terms of state actions as it relates to TANF is to reallocate any unspent TANF dollars on direct services for children and families with low income. So, we have seen a varying level of unspent TANF dollars throughout the last decade. We are anxiously awaiting budget documents next week to find out kind of where that amount is right now heading into this next state budget season. And then, we have put together this proposal around, making sure that any unspent dollars are directed back to the families and children who are most in need. We have also talked about allocating $50 million from TANF funds for one-time emergency assistance through the prevention, retention, and contingency programs. I talked about that a little bit earlier, how well utilized those one-time payments were during the pandemic, recognizing that a pandemic is not the only time that families in need have a use for dollars that can help to mitigate further emergencies. So these can be used for things like car repairs to ensure that something doesn't spiral out of control and keep someone from staying in a job. So we want to make sure that those flexible one-time payments are still around and to increase access to those. And then we were also proposing to increase the basic Ohio Works First cash grant by a minimum of $100 a month. So depending on family size, those amounts vary that families are currently receiving, but they are far below what someone would be making on even minimum wage, even if they're working, 30 hours a week, 40 hours a week. So, those are really not enormous amounts that families are receiving right now. And we know that there's a lot of need out there. It didn't just start with the pandemic, it's certainly been exacerbated by it. And I will turn it back over to Lisa quickly to talk about the food assistance piece.
Thank you, Tara. And again, Ohio Foodbanks are reliant on a variety of sources of food, including we've had more than a 2-decade-long partnership with the state of Ohio. Currently today, Ohio's reliance on food banks are at record levels. We now have more than a quarter of all Ohioans making under $50,000 saying they don't have enough to eat. And as the statewide Association of Foodbanks, we know that many of these families aren't poor enough to qualify for SNAP benefits. Therefore, they are heavily reliant on food that they receive from one of our 12 food banks and 3,600 member charities. We are requesting from the state of Ohio an appropriation of $45 million a year to help us address food insecurity and directing those dollars back into the local communities to allow us to procure Ohio grown fruits and vegetables and lean protein items to ensure that we have additional food on the shelves of our food pantries, soup kitchens, and shelters, as well as shelf stable items. So $30 million will be used to support direct food purchases. The other thing that families desperately need are non-food items such as personal care, personal hygiene, and household cleaning items. Ohio provides no additional support for these critical items that ensure and engender an active, healthy life. And we're requesting 12 million of the $45 million appropriation go towards the purchase of essential food items. Today in the state of Ohio, we are a critical lifeline, and far too many of our families don't know where their next meal is coming from. Ohio can do better, and we're requesting support. Thank you.
Thanks so much, Tara and Lisa. And with Advocates for Ohio's Future being such a wide range of partners and member organizations that cover a variety of health and human service issues and programs, we also wanted to highlight a number of the other priorities of our member organizations, and especially wanted to highlight our housing efforts, and would like to invite Gina Wilt, who is the Director of Advocacy at COHHIO, to share a little bit about what's happening at the federal level in terms of housing and what that could mean for the state. So Gina, go ahead and take it away when you're ready.
Sure. Thanks, Kelsey. Thanks for letting me tag on. I really appreciate it. It's an honor. I'm an active listener. I say that, of course, when I'm listening, I'm thinking of things to say. And I love collaborating with AOF. And I have like 3 reasons why I love collaborating with AOF. And the first one is it's smart. I think it's so smart to be in coalition. And it's also strategic, which is my second reason I love working with AOF. All of our issues intersect and overlap. So smart, strategic, and it's strategic because we don't operate in silos, and we can't operate in silos, and just thinking about that as well. And then my third thing that I was thinking about, and I think of Lisa a little bit on this too, is we're all stubborn. And I think we have to be stubborn. We're advocates, we have to be stubborn. And just really am honored to be a part of this group and to share a little bit with fellow advocates. So on the housing and homelessness front, kind of big picture perspective, according to the National Low-Income Housing Coalition, we know that that the United States, our renters in the US, our renters owe about $57 billion in back rent. So the typical renter on average owes about 4 months in rent. So, and that's very similar to the Ohio numbers that we have seen. So looking big picture, of course, obvious, we need to have long-term solutions because there's going to be a long-term economic impact. And so looking at what Biden has already done from really quickly out of the gate, he has really lined up, a lot of his commitments have lined up with some of our advocacy efforts and things that we're working on. And I think Steve mentioned this on the public health emergency. So we would like to see, as long as there's a public health emergency, that we prioritize keeping renters at home. Housing is healthcare. We want everyone to be safe and in their homes. So we are supporting Biden's push in that direction and will continue advocating for that. But of course, if we have these federal directives, we have to work with our state and local leaders to make sure that we're planning for that and that we are able to do that. The other big thing that Biden is working on is a commitment for additional dollars for hundreds of thousands of housing vouchers. So, finding housing vouchers, providing more housing vouchers, that's going to be a huge investment. And I think our local and state leaders have to be ready for that investment, ready to implement that federal investment. And that's going to take some very, very specific and strategic steps at the state and local level. So another commitment from the Biden administration is about, I think, $5 billion towards emergency solution grants. So directly moving people out of homelessness, and really thinking about folks that, our households and families that were in congregate settings that we had to move into shelter, or that we had to move into non-congregate settings, so into our hotels or motels. We would love not to send our families and households back into the shelter. So really trying to come up with creative ways to have more stable housing options post-pandemic. And then finally, the President Biden has a general plan to invest in the affordable housing crisis. So I think he wants to commit like 20 billion towards just the overall closing that gap where we know 1 out of 4 households that needs affordable housing, that housing help actually gets it. So kind of closing that gap. But again, if Biden is going to be investing all these dollars in the affordable housing crisis and closing that gap, we're really going to have to be ready to work with the state and our local folks on this focus, which is housing supply, whether it's development, rehabbing, preservation, but having that mentality and kind of embracing this culture of yes in my backyard, yes in my backyard mentality, yes in my backyard attitude, so that these federal investments can actually be successful in Ohio. And I do want to mention too, this isn't necessarily exactly budget related, but one of the executive orders that we're hoping will move forward through the Congress relates to the this legacy. And legacy sounds like a good word. It's not a good word in the sense of housing discrimination. We have a legacy of housing discrimination. And we had a couple of rules that during the Trump administration that we are looking to fix and move more into furthering fair housing rather than backtracking on fair housing. So that is going to be another job that we'll have to do. I think that the tone is opportunity for all, not even opportunity for all, expanding opportunity for all. So looking forward to taking that tone at the, from our federal leaders and bringing it to the state level. And I guess, kind of closing, really thinking about, will this new administration impact our state budget and our state policies? Will having folks like Marcia Fudge from Ohio, who's the HUD secretary, or Sherrod Brown, who is the Senate Banking and Housing chair, and even Portman, who's not running anymore, but that also means he's not going to have to worry about fundraising as much. So, what will his policies look like in these last couple of years? But will all of these federal kind of changes impact our state and our state policy, state budget? I think it will. Even just looking at issues like the minimum wage. A couple of years ago, if you would have asked me, oh, let's do minimum wage increase, I would be a lot more negative. Right now, I think that's changed. I think that there is an appetite for that for sure. And I do think that this is such a great platform, Kelsey. I'm glad that you brought us together. It really gets us thinking, and appreciate the opportunity for us to kind of think and prepare for what's ahead and be ready to make sure that all of these federal investments that are coming down the pike, that we're able to implement them in an intentional and purposeful way at the state level. So thanks for letting me tag on.
Gina, you're so welcome, and thank you for your kind words. I think that you really hit the nail on the head with what I feel is so special about Advocates for Ohio's Future, taking such a broad view of health and human services and recognizing that we have to work together to support families and make sure that everyone has the opportunity to succeed in our state. So we have a few minutes left to address some questions. If you have any, please go ahead and put them in the chat. We know that was a lot of information, especially for Friday morning. We understand, but wanted to give you a heads up that we will be holding these webinars every 2 weeks. So every other week, all the way, hopefully through June 30th. We know that the budget process is certainly a marathon, not a sprint, and that we will be coming back to you every other week with updates as far as what's happening in the budget, and we'll probably sprinkle some, if there's major legislation pertaining to some of our major issues, we'll of course highlight and take a deeper dive during those webinars as well. So our next webinar is scheduled for Friday, February 12th at the same time, 10:30 a.m. And we will be taking a look at the governor's proposed budget, a 30,000 level view, as well as our thoughts on how things could change, what's in, what's out, what we're going to keep our eye on as advocates in this space. Also make sure to keep up to date with our events as well as the events of our partners, new reports and kind of an updates about what's happening in these areas. Wanted to invite you to join our newsletter. We make sure that we provide those opportunities as directly to you as possible so you can get them all in one place and get the information, those opportunities. And as well, feel free to visit our website, again, www.advocatesforohio.org. And if you would like to revisit the recording or the slides of this webinar, it's /webinars. So thanks again, folks. We will take questions in the chat. We have just a few minutes, but thank you for your time still morning, this morning, and we hope to see you again soon. Thank you so much.